Hello, this is Dr. Mike Dillard at the Providence Clinic. On behalf of Dr. Jeff Adams, Ms. Charlotte Olson, and Ms. Amy Sharp, I'd like to talk for a few moments about the challenges our communities face now with the COVID-19 virus. Many questions have arisen as our children begin to start school, the symptomatology that may be involved in children specifically with the virus. Unfortunately, the news here is a little bit conflicting as you're seeing more and more information come out every day. But as far as the moms at home and taking care of their children and all the worries that we tend to share now especially, many of the symptoms that your child would normally have this time of year and starting school, with the weather changing in East Tennessee, the fall air getting a little bit cooler, some of us are sleeping with our windows open, the typical things we see with children during this time of year is basically the exact symptoms that they're going to have with COVID. It is becoming even more difficult to distinguish, does my child have COVID? Is this something that I need to worry about? Or is this the typical childhood illness that happens during the fall? There seems to be somewhat of an amount of hysteria that goes around, and that's basically because these symptoms are very similar. It basically is very difficult to distinguish. If your child comes home with a runny nose and has a low-grade fever, most likely he's done that this time of year for the past several years. Don't necessarily believe that he has the COVID virus. At the same time, we need to maintain a certain level of watching our children for any of those other more serious symptoms that may come about.